Hi, welcome to Pamela Price Unfiltered. I'm your host, Pamela Price, and this is the space and the place for real talk. This podcast season is sponsored by the Eloise Real Estate Group. Eloise Middleton is more than a licensed real estate professional. She is a miracle worker. With over 20 years experience in the Bay Area market, Eloise specializes in residential, single-family, and income properties, including luxury homes, probate trust sales, first-time home buyers, and investors. Their motto is selling real estate is what we do, but service is who we are. If you are in the residential real estate market, call Eloise Middleton at 510-386-0547. Welcome to the show. Let's talk about it. Welcome to Life in Trump's America. This is Breast Cancer Awareness Month, and breast cancer is creating a health crisis for Black women. In 1966, Reverend Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane because it often results in physical death." Dr. King called for massive direct action to address the segregated and inferior medical care being received by Black Americans, and more lawsuits to force doctors and hospitals to comply with the Civil Rights Act. He accused the American Medical Association, the famed AMA, of a conspiracy of inaction in civil rights. For years in California, there was a fight for universal health care called Medicare for All, led by the California Nurses Association. Despite its popularity and the significant cost savings for all Californians under the plan, California legislators were not able to pass their great ideas into laws. Fast forward to 2025, and Donald Trump's One Big Beautiful Bill has passed, cutting more than $1 trillion from America's budget for health care. Effective January 1st, 2027, Medicaid-insured patients will have more strict work reporting requirements in the form of 80 hours a month, more frequent eligibility redeterminations every 6 months, and reduced retroactive coverage. Some patients who are deemed, quote, medically frail or have a serious complex medical condition will need to prove their status to obtain an exemption from the work requirement. Often, a cancer diagnosis and treatment is a full-time job for a patient and their caregivers. Many people are simply too physically sick to hold or apply for a job. Medicaid is a lifeline for low-income patients, including many Black women. The sickest people on Medicaid will suffer the most under Trump's One Big Beautiful Bill because they are the ones who most urgently need the care and are the least able to be their own advocate. The Center on Budget and Policy Priorities, a nonpartisan research and policy center, says the number of uninsured Americans will rise by more than 10 million people by 2034, including many cancer patients. If the subsidies from the Affordable Care Act are discontinued under Trump's One Big Beautiful Bill, an estimated 5 million people will no longer be able to afford health insurance coverage. Research and experience have shown that having health insurance is one of the most important factors in surviving cancer. Health insurance is a major predictor whether you will survive a cancer diagnosis because cancer care is unaffordable for most people. Depending on the diagnosis, most cancer patients need between 4 and 16 treatments of chemotherapy, and it can easily cost up to $50,000 per treatment. Reductions in Medicare coverage will cause a reduction in cancer screenings, delayed diagnoses, and more late-stage cancer cases. Navigating the new requirements will make it harder to create a comprehensive health care plan for cancer patients. The less obvious impact of more paperwork and cuts in state budgets will also limit coverage and access to life-saving medical care. One of the immediate impacts that the states have already seen is a limit on their ability to collect healthcare-related taxes. And the one big beautiful bill is expected to create huge shortfalls in state budgets for healthcare. Most Medicaid patients will not immediately lose their insurance coverage, but the clock is ticking. Breast cancer is the most common cancer among Black women. This disease is personal to me as it runs in my family. I have lost too many first cousins to the disease, and my beloved sister Tonsa is a survivor of multiple bouts of breast cancer and is living with metastatic breast cancer. Black women are 40% more likely to die from breast cancer than women of any other racial or ethnic group. Black women under the age of 35 are diagnosed at twice the rate of white women and die at 3 times the rate. Survivors are incredibly resilient, strong, and determined to lead us to a cure for cancer. Their health care providers are the true lifesavers. Sisters Network, Inc. is a national survivor-led network that supports Black women facing down breast cancer with resources and support. Project LEAD, standing for Leadership, Education, Advocacy, and Development, is an intensive training program aimed at equipping breast cancer advocates with a solid foundation in cancer science, research, methodologies, and advocacy skills. The program is structured to prepare participants to engage effectively in discussions and decisions regarding breast cancer research and policy. I am so proud of my little sister Tonsa, who completed their intensive training program at the Project LEAD Institute and serves as a nationally recognized advocate for survivors. Advocates say now the most important thing that physicians and healthcare systems can do is explain to our elected representatives how the Medicaid cuts of the one big beautiful bill will cause devastation and impact access to care for everyday people. We can do our part by encouraging Black women, and particularly young Black women, to get early testing and mammograms for breast cancer, and encouraging the elected Democrats in Congress to hold the line and refuse to acquiesce to the health care cuts passed in the one big beautiful bill. We must support our friends and neighbors and family members who are impacted by cancer, disease, and particularly breast cancer, as well as the government shutdown, while the fight continues for health care access. In the fighting words of Senator Nina Turner, everything we love is on the line. This podcast season is sponsored by Lawyers for the People. Lawyers for the People represent clients who have suffered serious injuries or death from police or negligent jail deputies and medical staff. Lawyers for the People was founded by Dante Pointer and Patrick Bullna, former associates of the law office of John L. Burris. They believe in using the law as a sword and a shield for their clients. They handle personal injuries, civil rights, employment discrimination, jail abuse, and police brutality cases all over California. They don't just talk about results, they get them. Call 510-617-1938 for a free case evaluation. This podcast is sponsored by the Shukla Law Firm, a leading San Francisco law firm that advocates for employee rights. Attorney P. Bobby Shukla is the 2024 San Francisco Trial Lawyers Association Trial Lawyer of the Year with a winning record against major corporations and government agencies for harassment, discrimination, retaliation, whistleblowers, and pay equity. When you need a trusted advocate to get your voice heard and want action, call the Shukla Law Firm at 415-847-3983. Welcome to Pamela Price Unfiltered. My special guest today is Colleen Burton Allen, the Executive Vice President of Sisters Network. She is the executive vice president and she leads the National Strategic Partnerships, Fund Development, Community Engagement, and State Policy Initiatives for Sisters Network, Inc., a
That's right.
proactive network of sisters surviving and advocating for the cure to breast cancer and survival for breast cancers. Miss Allen brings over 30 years of experience, and she's recognized as an exceptional relationship and coalition builder, working with national, state, and local elected officials, key corporate business leaders, community activists, and advocates, and faith based leaders. The Sisters Network was founded in 1994 by Karen Eubanks Jackson, a 4-time breast cancer survivor who saw the need for a survivor run network to support Black women. Breast cancer is the most common cancer among Black women, and Black women are 40% more likely to die from breast cancer than women of any other racial or ethnic group. Black women under the age of 35 are diagnosed at 2 times the rate of white women and die at 3 times the rate. Welcome to the show, Miss Allen. Thank you so much
Thank
for joining.
you. Thank you, Pamela, for giving us a platform to amplify our voice and our work in the Black breast cancer space. And thank you for sharing those statistics, because I don't think everybody really understands the staggering statistics that we're working with Black women. And we call it a Black breast cancer crisis.
Absolutely. It is a crisis. It has been building. As I shared with you, my family has been stricken by this disease, and my beloved sister is living with metastatic breast cancer. So I really appreciate having a network of Black women, sisters, who are tackling this problem. So tell us about the crisis, and from your perspective, what is happening?
Well, so Sisters Network has been on the front line on the Black breast cancer movement as you mentioned, since 1994. So we're 31 years strong. And we have a very unique model. Let me first say that. We are a national Black breast cancer organization headquartered in Houston, Texas, and we have affiliate chapters around the country, over 25, about 28 affiliate chapters right now that are survivor run. So that's a very unique model. These are ladies who are either in remission, some still in treatment, who are volunteering their time to be the boots on the ground for our organization in their respective community. And so we try to educate, empower, and provide support and resources to women who are currently battling breast cancer, and making sure that access for any woman who wants to get a mammogram is affordable and is paid for by us when they need them, if they don't have the funds for it. And so, like you said, the statistics are staggering with Black women. In fact, in 2025, according to the American Cancer Society, approximately 40,530 new cases of breast cancer are expected to occur among Black women alone. As you said, under 35, 2 times more likely to be diagnosed, 3 times more likely to die. Triple negative breast cancer, which is one of the most aggressive forms of breast cancer. Unfortunately, we're 1 in 5 times more likely to be diagnosed as compared to 1 in 10 for all ethnic groups. So, I mean, I could go on and on. The bottom line is early detection is not a slogan. We need our sisters to be getting their mammograms, preferably a 3D mammogram, which is the latest, greatest, that gives more views of the breast. If you have family history or other issues, you may need a ultrasound in addition to a mammogram. And so we're just trying to empower our women so that they understand what they're up against, empower them with the information that they need to go and ask for the mammogram, ultrasound, MRI, or whatever diagnostic test they need, and to not have that white coat syndrome if they are not getting what they need, that they can move on to another physician who's going to provide the service they need.
Obviously. Great, great. Yeah, I mean, that's the early detection. Talk about how important that is.
Oh, absolutely. I mean, if it's caught early for any woman, breast cancer, your odds are dramatically increased if you catch it early. So that's why it's important to know your body. If you feel something, say something. If you something doesn't feel normal, get it checked. It's better to get it checked than to wait. And we have women who wait, and we are, as a Black community, we are usually the anchor of the family, and so we make sure the hubby's okay, the boyfriend or the kids or the grandma or the everybody, but we're last on the list. And so we're saying to our sisters, if you don't put yourself first on the list, you won't be on the list because you won't be here if you're not getting your mammograms and taking care of yourself. And that goes with diabetes and heart disease. We unfortunately lead the way in most of these very serious health challenges, but breast cancer is survivable. It can be survived if you get it early.
Mm-hmm. How does the number of cases of breast cancer compare to other forms of cancers, like blood cancers? I was active for some time with the Leukemia and Lymphoma Society. Talk
Sure.
about how that relates to that.
Yeah, so breast cancer is the most common cancer among Black women, second behind lung. So, as far as like lymphoma and leukemia, I'm not really aware of the statistics in comparison, but I do know that lung and breast are the two leading particular cancers that we get diagnosed with, and that our mortality rate is very disproportionate to other ethnic groups.
Talk about the mortality rate, the disparity in the survival of this disease, breast cancer.
Right. So you mentioned about that we're 40% more likely to die of breast cancer. Um, we get diagnosed younger than a lot of other ethnic groups. We're again diagnosed with more aggressive forms of cancer. Obesity and other health conditions don't help you in terms of fighting breast cancer, your body in terms of that. And we are diagnosed with more advanced, like you said, your sister with metastatic breast cancer. One of the concerns that we have as an organization, and we're going to be doing a lot more state policy work moving into 2026 under our Sisters Network Center for Public Policy. Mrs. Jackson, who is the founder and CEO, she is a 4-time 31-year survivor. And what she feels and has said for many years is that the baseline mammogram needs to go down to save lives. If we could get them to move it to 35, we can save a lot of our sisters and other women's lives, because you're going early, you're catching it early. You have to understand, when women are in their mid 30s and early 30s, they're childbearing, they're professional, they're working, they're starting their family, getting married, etc. And so if they get pregnant and they have a tumor and they're not familiar with their body or not paying attention, the tumor is feeding off the hormone. So when you go get your first mammogram at age 40, you're stage 2, 3, 4, because they tell you to go at 40. But if you have this perfect storm going on in your body at 35 and you wait 5 years, I mean, it is what it is. And so that's why, until those guidelines are adjusted, we're saying to our sisters, you've got to be proactive, because we are, as an organization, are getting calls with these young women. We just lost a member, 26 to TNBC. 26. Another young lady, 32, 31. The calls are younger and younger and younger. We've actually started an initiative called Take Care of You, Sis. And we're traveling around the country. It's called Take Care of You, Sis, Brunch and Learn Breast Health Tour. And these young ladies like to go to brunch, the under 40 crowd. They think they invented brunch. We know differently. But anyway, we're meeting them where they are. They like to go to brunch. We just held a brunch in Chicago last weekend, and we had 50 young women under 40, non-diagnosed. The goal of the program is to get them to normalize the conversation. So we had a radiologist and a breast surgeon come to a brunch that we hosted in downtown Chicago, complimentary for the young ladies. We have beauty swag with some of our beauty partners, so they get a little swag bag after they do their surveys and stuff. But just to have a conversation, and we didn't have them do PowerPoint. We had them come and just give a high level picture of the state of Black breast cancer as it relates to young women under 40. And they were stunned by the number of the statistic about under 35. And so it gave them an opportunity to have a conversation with the medical experts, ask questions that they would never normally not get to ask, about what should I do if I have implants? One young lady asked, what about nipple rings on your nipples? How does it, the radiologist says, don't come in there with those when you're getting a MRI because the machine's going to suck you right in. So when people tell you don't wear metal, they mean it. Like, please make sure that you really adhere to those guidelines when those doctors are telling you these things. But they had a conversation with these doctors and learned so much. And it was an opportunity to introduce them to medical professionals in their community. Should they or someone else in their family need their care, they can say, hey, I met this doctor or this radiologist during this particular brunch. And so they walked away with some knowledge. They walked away feeling empowered. And they had a better understanding about what they need to do to make their health a top priority. So we're super proud of it. We went last year, we kicked it off last year. And so we were in Houston, New York, Chicago, Atlanta, DC, and I forgot the other city we went to. And then we just kicked it off to go. We were in Dallas, we're in Chicago, we're going to Charlotte. On the 8th, we'll be in Nashville on the 15th. So anybody in Nashville and Charlotte, please get on our website, sistersnetworkinc.org, and register. And then we ended in Richmond, Virginia.
Okay.
Yeah.
What is behind? Are there theories about what's behind the alarming rate of cancer in young Black women?
They still don't know. There's a lot of research that's being done, but we don't know. We just know that it is a problem. We know that we are getting it younger. The statistics have not changed. And as I was saying about Mrs. Jackson, she wants us to advocate as an organization to, on the state level, at least at this point, to see about some provisions to allow for age 35. And one thing that was very frustrating to her is that she was sharing with us that, recently, maybe 2-3 years ago, they dropped the guideline to 40, right? It was at 50, they dropped it to 40. What she shared and what I've since learned as well, is that it was previously at 40. They raised it to 50 and they brought it back down to 40. So she says, I can't applaud that because you never should have raised it to 50 to begin with. But she says people who haven't been around long enough in this breast cancer space don't know that. So they're applauding it. I can't applaud it. You move it to 35, you've done something. You just went back to where you should have never moved it from the beginning. So we as an organization are just trying to sound the alarm to our sisters. It's a problem. You can survive. You get the people who talk about their hair. They get concerned about that, but your life is more important.
Right. When my sister was going through breast cancer the first time, we just kept singing, I am not my hair, right? Remember that? I am not my hair.
Exactly.
We just really adopted that as the anthem. Like, I am not my hair. That is not worth my life,
Yeah. Yeah, it's true. And I mean, if anybody goes on our website, they can see they can download these statistics to learn more about what we're facing. But it just says about 12% of, these are all from like the American Cancer Society, their 2025 cancer statistics. About 12% of Black women will be diagnosed during their lifetime.
That's huge.
The 5-year survival rate for Black women is 81% as compared to 91% for white women. So we are just trailing in every aspect of this disease. And so, like you said, it touches everybody. If you could put a group of people in one room and say, have you been touched directly or indirectly by breast cancer? I'd say 85% of the people in there have been touched in one form or another, directly or indirectly. And that's not okay. Absolutely. It's just not okay.
Yeah. We had a very popular and well-respected news personality, Faith Fancher, here.
Okay.
Took all of us through, those of us who are old enough to remember that, that went through her journey and her ultimate demise through the breast cancer. But it was, raising that awareness. And so many women were sharing that, yes, we're all being impacted by this.
Yeah.
So tell me, how can women in California, I'm in the Bay Area, San Francisco Bay Area, very activist
Bay
place.
Area.
Yes, Bay Area. How can women in California connect and get connected to the sister network?
Right. So, as I mentioned, we have survivor run chapters. Over the course of 30 years, as you can imagine, that model, we've had a lot of chapters. We've had as many as 50 chapters, to be quite frank. But because of this model, we lose chapters sometimes, unfortunately, because of the nature of the business. And then sometimes we have chapters that just, the leadership is just they're tired, they can't do it anymore, and we understand. We've had a chapter in both Oakland and San Francisco. Actually, when I first talked to you, I couldn't remember the name of our former San Francisco chapter president. Her name was Gail Bishop, and she was a jewel. But when we lost Gail, that's been probably about a good 10 years now. It just, no one ever wanted to step up to really organize, and because it's a lot of work. There's expectations that we have. It's a national brand. There's some, required programming that you must do as a chapter, and then you create unique programming to your respective community. So we have very high expectations of the ladies, and not everybody wants or has the ability or the interest to do that, and we understand. But Gail was a jewel. And she, unfortunately, we did lose her about 10 years ago, and she was San Francisco strong. She was all about the Bay. I'm originally from LA, so I'm a Southern California girl. Sorry, I know the Northern Southern thing. It's a difference.
It's different, but we're all in the bubble of California.
All in the bubble of California, but I live in Houston, Texas now, but always a Cali girl. But yeah, so we have had a presence in the Bay Area. Would love to have that again. Just haven't had the right person to step up and say I want to do this. So if anybody's listening, give us a call, check out our website, sistersnetworkinc.org, look under chapters. If there's information about how to start a chapter. And the women need you. If you go on our website, you'll see a map, and you'll see we're very strong along the eastern seaboard, the South, a little bit in the Midwest. The west side of the United States, we are not as strong as we used to be. We've had, chapter in Nevada, Arizona, a little bit more on the West Coast. And so we're really going to be trying to get a little bit more proactive to see if we can get, shake the fence a little bit and get somebody to step up to the plate to service these ladies, because we get calls. We do have ambassadors in those respective areas, but we don't have active chapters.
Mm-hmm. Yeah, well, you have a beautiful website, and certainly,
thank you.
Yes, and the information is there, and the need is great, and so we certainly would want to encourage anybody in our audience in the Bay Area, in California, that's interested to go to sistersnetworkinc.org and check it out. It is.
Yeah, because we have the Karen E. Jackson Breast Cancer Assistance Program, where we provide financial assistance to survivors across the nation. It's been around since 2006. We've given out about $2 million between mammograms as well as financial assistance, where we pay towards your rent or your utilities. And we have a lot of ladies from the California Bay Area, applying. Susoon, I know all the areas up there, so we get applications, in requesting assistance. Fairfield, what's it called?
Yes.
Fairfield. Yeah. Okay. I know.
That's the Bay Area is 9 counties strong.
So. Yeah. So we get a lot of interest and request for financial assistance, and we're happy to provide it. And we are a Black-led, Black-focused organization. When it comes to our financial assistance, the breast cancer assistance program, whether it's the financial assistance or it's the needing a mammogram, we look to support any woman who is in need, because breast cancer does not discriminate. We just want to make sure that we are educating our women even more. But when it comes to that particular program, if you are of another ethnicity and you are a survivor who's, it's no one's budget, you need our help, and you meet the criteria, we're going to help you. If you are a woman in need of another ethnicity who needs to get a mammogram or an ultrasound, and our program is open and we have the funding at the present time, and you meet the qualifications, we will make sure that you get the proper care. And Mrs. Jackson will only pay for 3D, not 2D, because she feels the 3D is the latest, greatest. And she's like, I won't want anything less. So why would I want less for the women that we're supporting? So we'll only partner with facilities that are willing to give the ladies a 3D. If they won't, then we'll find another facility. She's great. She's very adamant about that.
As well, she should be. She obviously is the pioneer and understands as well as the historian. So that's a blessing to have someone of her stature and her commitment to this issue, and obviously her resilience. One of the things that I know about breast cancer survivors is particularly Black women, incredibly resilient.
So resilient. And she found her last one in 2019. She apparently gets a sensation in her body, some feeling in her body. So she kind of knows something's off. And she had a mammogram. It didn't show. She asked for an ultrasound. It didn't show. She pressed for an MRI and it was there.
Wow. Wow.
So that is a prime example and it was stage 0.
Wow.
But she knew it.
She is obviously a living lesson.
Yes. Yeah. She pressed and, first they gave her a little pushback, but she, pressed on, and they did do the additional testing and it was there. And so that is a good example of advocating for yourself, because I think as a community, we sometimes get the white coat syndrome, and, they know everything and they know a whole lot. Obviously, they're doctors, but if it's not the right doctor for you for whatever reason, you have the right. And it's not being disrespectful. It's not being rude. It's about making sure you're doing the best due diligence for your health care to go to someone else who is hearing you, seeing you, and acting on whatever it is that you feel needs to be done.
Absolutely. That's such a great and an important point. Mm-hmm. And for our people particularly to know.
Oh, for sure.
Like you say,
let's not forget about our men, because men do get breast cancer, and we're seeing that on an uptick. And unfortunately, our brothers get it more frequently than the white men. So we want our men to, especially if you're a son of a survivor, we want you to be very familiar with your chest. And Mrs. Jackson tries to call it chest cancer so that it's a little bit more palatable for the men. But they need to be familiar. They need to consider genetic testing, as do the women, so that we make sure that we know our family history. And just because the genetic testing may not show that you definitely have the gene, you still need to be. It's not a freebie once you do that and it says no. We still need you to be vigilant about your body.
Exactly. Yeah.
Because no test no test is wrong until it's wrong.
Exactly. That is so valuable and true, right? Until it's wrong. And I try to tell folks all the time, like you said, the doctor knows a lot, but the doctor doesn't know you the way that you
know you. Exactly. So being in tune with your body, acting on it when you feel it, and and make yourself a priority. Don't put yourself last on the list, because your family loves you. They need you, and they need you to be healthy. And so if you're not healthy, it impacts everybody in your family. And so they're not asking. That's a decision we make on our own. Nobody's telling us to do it. We just kind of say, well, we'll take care of this and we'll do this, and they would want you to put yourself first.
Right. Well, your health is your wealth, and you don't have your health, nothing else is gonna.
Yeah.
You can have, I think about Steve Jobs. He had all that money, but hey, he's gone.
Gone. And so you're right. Your health is your wealth. And, I know we're all guilty of liking, we're going to the holidays, the pies and all the good stuff. And that's okay, I think, but it's got to be in moderation, or alcohol in moderation, everything in moderation. When it's excess, it's not going to end well.
Right. Exactly. Your body is not built for excess.
Yeah.
And, I know as a working woman for years, as a trial lawyer, I'll get to it. I'm working. I got to get this done.
Got to get the grind.
I got it. And I'll get to it eventually. And then, eventually is when my body breaks down and says, stop. Like,
yeah. And I'm guilty of it too. I have to sometimes take myself and say, take a step back. This can wait. Everything will not fall apart if this isn't done at this moment. And I have to give myself permission to do that. And it's not easy. It's rewiring the brain, but I do it.
and make the appointment to
And
go
make the appointment.
and test, get
Oh
that.
yeah, for sure. I do it, and you just gotta put yourself. If you want to be around, you need to put yourself first and take that little time. A couple hours is not going to, mess up everything.
Right. No, it's not. It'll be there tomorrow.
Yes,
Right.
it will.
So, well, thank you so much for joining
Thank
me on
you.
Pamela Price Unfiltered and spreading the word. And we will do as much as we can during Breast Cancer Awareness Month, Chest Cancer Awareness Month.
Yes, and if anybody needs us, we thank you again, Ms. Pamela, for giving us a platform to share what we're doing. Please just contact us at sistersnetworkinc.org, and we're here to help and serve. And if we don't have the resources or know, specifically what we need to do, we will connect you with someone who can help you, because no woman should be alone during this time. And we want to be that support and that light for you.
Absolutely. Thank you so much, Ms. Allen.
Sure.
All right.
All right. Be well.
You too. Take care.
Okay.
Thank you for tuning in to Pamela Price Unfiltered. Be sure to like, share, and subscribe to our YouTube channel to watch the show and to my Substack to read the weekly word. Your support keeps the conversation raw and unfiltered. And you can listen to this podcast wherever you get your podcasts.